I told you we will be taking you to the UK now. Our guest is already standing by. She's Dr. Montio Morgan. She is a consultant ENT surgeon in Basildon, Essex, and is the current chairperson of CamDocUK, the Association of Cameroonian Doctors in the United Kingdom. And CamDocUK has about 70 active members spread across the whole of the British Isles, and their members are in all different specialties of medicine, such as family practice, internal medicine, obstetrics and gynecology, healthcare, psychiatry, just to name a few. Now, I told you she's already standing by. Hello, doctor. The first question, what appraisal can you make of the management of COVID-19 in Cameroon?
It is a real pleasure to be with you this evening and an honor to have been invited to contribute on your program. Regarding the response to COVID-19 or coronavirus in Cameroon so far, the directives have been really good and have followed WHO guidelines. As we know, across the world, the message has always been one of prevention being better than cure. And this actually is what has been broadcast and includes the following messages. Firstly, hand washing. Good hand washing with soap and water, taking the time to spend at least 20 seconds making sure that the front of the hand, the backs of the hands, the thumbs, the fingertips, both sides, as well as the wrists are covered. So washing your hands in running water for 20 seconds. That's the first thing. Secondly, in the absence of running water and soap, using alcohol hand sanitizers with at least 70% alcohol base. So this also helps to keep the hands clean. And the idea is really to try and avoid rubbing your eyes, nose and mouth with dirty hands, because these are the points of entry of the virus into the body. The other thing is the virus is actually spread by droplets, and so when you sneeze or cough, do so within the crook of your elbow or use a tissue and immediately dispose of it. And finally, social distancing or staying apart from other people, not going into areas where it is very crowded, and then when you have symptoms to actually self-confine, stay at home, stay away from other people for at least 7 days, because this is the time when usually the symptoms will be manifesting. The other thing is, in our context of urban overcrowding, the recent guidelines for people in the street to use good quality face masks and to have a good technique of applying them and not touching them all the time so as not to come in contact with the virus has really been a good addition to the fight against COVID-19.
Okay, thank you, doctor. We're learning something, not to touch the face mask because you can infect it. Now, this other question, Dr. Montio, what's the help or assistance you're bringing in the fight against COVID-19, for example, in Cameroon?
What help or assistance are we bringing in the fight against COVID-19? CamDocUK have produced a number of videos to provide moral and practical support for our colleagues and those who are working on the terrain in Cameroon. Furthermore, we have produced educational videos on the correct preventative measures to curb the spread of COVID-19, as well as mythbusters to try and dispel some of the rumours that are being shared on social media. These have been done in English, French, and in Pidgin so as to get as wide a coverage as possible. Finally, and most importantly, CamDocUK have launched a massive fundraising appeal in order to support the provision of personal protective equipment for our health personnel back in Cameroon, such as N95 masks and overall suits such as these, and also some visors or goggles in order to protect the eyes area when patients are being seen by our health personnel. All of this information can be found on our website, as well as some of our videos are on our Facebook page and on YouTube. So our website is www.camdocuk.org.
Brothers back home. Now, we also want to know exactly how our brothers and sisters back in the UK are coping with this deadly virus.
How are Cameroonians in the UK managing and coping with COVID-19? That's a very good question. Like everybody else, we are following the government's advice to stay at home, only go out when we have to, have one period of exercise during the day, and to stay safe and protect our National Health Service workers. Only those key workers who have to leave home to go to work are doing so, and the rest are working from home if they can. We are finding that social media is keeping people connected, and that we are having to develop new ways of interacting socially, even though these may not be what we would have chosen. For example, I personally belong to an alumni association, and we were supposed to have our meeting this past weekend. It still went ahead, but it went ahead on Zoom. And so that was perfectly fine. We all got dressed up as we normally would, and the only thing that was missing was item 11, but we managed without that.
How Cameroonians love the item 11. When we talk about item 11 at the end of every gathering, we need to share something. That's what keeps us together. Now, Doctor, you talked about social media keeping people busy during this very difficult period of confinement. Now, we've been hearing some news on social media. Is it true? Isn't it true? We want to get it from the horse's mouth. That's you. Are there any cases of infected Cameroonians living in the UK?
Yeah. So, are there any cases of infected Cameroonians living in the UK? Unfortunately, we have lost some members of our community due to COVID-19 infection, and we extend our deepest condolences to the bereaved families. However, thankfully, 80% of people will only have mild to moderate symptoms, and these will get better with supportive measures such as vitamin C, paracetamol, steam inhalation, as well as respiratory exercises.
Doctor, for all those other tips. Now, any other best practices you may want to share with the medics in Cameroon?
Do we have any message for our colleagues in Cameroon? First and foremost, definitely we want to send them a message of solidarity and support, because we are very well aware that a lot of them work in conditions which are less than ideal, even before this coronavirus pandemic. We appreciate all the work that they do, and we thank them for being there to look after all our families and friends. We are also trying really frantically to get much needed PPE supplies to the areas which need them most. We're also putting some effort into supporting the homemade and locally made masks and hand sanitizers for distribution to the population.
Now, I'll leave you go because you are very busy. One last word of advice to all those back home. I'm talking about your brothers and sisters here in Cameroon. One last message as far as curbing the spread of COVID-19 is concerned, Doctor.
So, what advice for the people at home? I think as far as possible to follow the guidance from the Ministry of Health, which boils down to prevention, which is better than cure. Try and avoid getting worked up by all the messages on social media. Get information from reputable sources such as the Ministry of Health, the WHO, and doctors' organizations such as CamDocUK. There are also other doctors' associations and people who are putting out really good information from around the globe, and these can be very useful. If you can send some questions to our website, and we will try and respond to those as soon as we possibly can. Certainly seek advice from the government helpline 1510, and if you do get infected, certainly don't panic. 80%, as we've said, of people will get better and will only have mild to moderate symptoms. So self-isolate if you have symptoms. Stay in a room away from other people in the house if you can, and try and encourage cross-ventilation by keeping the windows open. Take a lot of fluids, take vitamin C, as well as paracetamol and any other supportive medication from your own doctor.
Thank you so much, Doctor. I remind our viewers that you're Dr. Montio Morgan. You